हेलो फ्रेंड्स, वेलकम टू ऑल इन आवर चैनल नर्स अड्डा। हमारे 1000 MCQ सीरीज़ का ये सेकेंड पार्ट है। तो विदाउट एनी वेस्टिंग ऑफ योर टाइम लेट्स स्टार्ट। क्वेश्चन नंबर 51। ए पेशेंट डेवलप सडन डिस्निया, चेस्ट पेन एंड हेमोप्टाइसिस आफ्टर प्रोलॉन्ग्ड बेड रेस्ट. द मोस्ट लाइकली डायग्नोसिस इज. Your correct option is option B, pulmonary embolism. Moving to the next question, question number 52. Which electrolyte imbalance is most commonly responsible for the development of torsades de pointes? ये भी बहुत बार पूछे जा चुके हैं ये क्वेश्चंस. Your correct option is option B, hypokalemia. Moving to the next question, question number 53. Which artery is most commonly affected in an epidural hematoma? Your correct option is option A, middle meningeal artery. Moving to the next question, question number 54. A patient with chronic kidney disease is receiving erythropoietin. The primary purpose of this drug is to. Your correct option is option B, treat anemia. Moving to the next question, question number 55. Which cardiac biomarker remains elevated for the longest duration after acute myocardial infarction? Your correct option is option C, tropi or troponin I. Moving to the next question, question number 56. A patient receiving unfractionated heparin therapy should be monitored using. Your correct option is option C, APTT. Moving to the next question, question number 57. Which valve is most commonly affected in rheumatic heart disease? Your correct option is option C, mitral valve. Moving to the next question, question number 58. Which microorganism is the most common cause of catheter-associated urinary tract infection or CAUTI? Your correct option is option B, E. coli. Moving to the next one, 59. A patient with diabetic ketoacidosis should receive which treatment first? Your correct option is option B, IV isotonic normal saline. Moving to the next question, question number 60. Which electrolyte abnormality is most commonly seen in tumor lysis syndrome? Your correct option is option C, hyperkalemia. Moving to the next one, question number 61. A patient admitted with acute pancreatitis suddenly develops bluish discoloration around the umbilicus. This clinical sign is known as. Your correct option is option B, Cullen's sign. Moving to the next question, question number 62. A nurse notices that the drainage from a chest tube has suddenly stopped, but the patient develops increasing respiratory distress. The priority action is. Your correct option is option B. Assess the tubing for kinks or obstruction. ये क्वेश्चंस भी बहुत बार रिपीट हो चुके हैं. Moving to the next question, question number 63. Which electrolyte imbalance is most likely to occur after massive blood transfusion due to citrate toxicity? Your correct option is option B, hypocalcemia. Moving to the next question, question number 64. A patient with a fractured femur suddenly develops confusion, petechial rash and dyspnea. The nurse should suspect. Your correct option is option B, fat embolism syndrome. Moving to the next question, question number 65. A patient with chronic kidney disease is receiving calcium gluconate for severe hyperkalemia. The primary purpose of calcium gluconate is to... Your correct option is option B, stabilize the cardiac cell membrane. Moving to the next question, question number 66. A nurse is caring for a patient with a tracheostomy, which finding indicates that suctioning is required. Your correct option is option B, coarse crackles heard over the trachea with visible secretions. Moving to the next question, question number 67. A patient with COPD is receiving oxygen therapy. Which device delivers the most precise oxygen concentration? Your correct option is option B, Venturi mask. Moving to the next question, question number 68. A patient with chronic obstructive pulmonary disease or COPD is instructed to perform pursed lip breathing. The primary purpose of this technique is to... Your correct option is option B, prevent airway collapse during expiration. Moving to the next question, question number 69. A nurse is preparing to administer mannitol to a patient with raised intracranial pressure. Which assessment finding requires the greatest concern before administration? Your correct option is option B, crackles on lung auscultation with pulmonary edema. Moving to the next question, question number 70. A patient receiving total parenteral nutrition or TPN suddenly becomes restless and diaphoretic. The nurse should assess first for... Your correct option is option B, hypoglycemia. Moving to the next question, question number 71. Which laboratory value is the best indicator of long-term glycemic control? Your correct option is option B, HbA1c. Moving to the next one, question number 72. The most common organism causing ventilator-associated pneumonia or VAP is... Your correct option is option B, Pseudomonas aeruginosa. Moving to the next question, question number 73. A patient with syndrome of inappropriate antidiuretic hormone secretion or SIADH is most likely to have... Your correct option is option B, concentrated urine. Moving to the next question, question number 74. Which vitamin deficiency is commonly associated with Wernicke's encephalopathy? Your correct option is option A, vitamin B1. Moving to the next question, question number 75. Which electrolyte imbalance is most likely to cause prolonged QT interval on ECG? Your correct option is option B, hypocalcemia. Moving to the next question, question number 76. A patient with severe burns is at highest risk of developing which type of shock during the first 24 hours? Your correct option is option B, hypovolemic shock. Moving to the next question, question number 77. Which finding is most characteristic of Cushing's syndrome? Your correct option is option B, moon phase and central obesity. Moving to the next question, question number 78. A patient receiving streptokinase develops bleeding from the IV site. The priority nursing action is? Your correct option is option B, stop the infusion and inform the physician immediately. Question number 79. The incubation period of hepatitis A is approximately? Your correct option is option B, 15 to 50 days. Moving to the next and our last question, question number 80. The most sensitive indicator of fluid resuscitation in a patient with shock is? Your correct option is option B, urine output. Wait for the part 3. पार्ट 3 और भी चैलेंजिंग होने वाला है, सो इफ़ यू लाइक द वीडियो प्लीज़ सब्सक्राइब. थैंक यू फॉर वॉचिंग.